I'd see Tunstall as a world leader in the delivery of telehealth and telecare type services. These are devices and products that help to keep people safe and independent in their own living environment. One of our key roles moving forward in our business is the emergence of telehealth, being able to support people at home, managing their vital signs, working with organisations that provide coaching and advice on how people can take care of themselves at home, looking after a chronic disease or a health condition that where they need to have support to remain independent. Well, I think digital technology isn't a new thing. It's been around for many, many years. There's a difference of types of services, and I think what's happening, you can see the future that people are becoming more adept at using technology, which is going to create opportunity and also avenues by which people can get support more easily and readily, and also using systems that already exist. So now we have people that already have computers and devices in their home. So the concept is that the products and services are changing, so people will be able to get these types of services a lot easier. So it's not new, but what is happening is people are becoming more adept at using them, and equipment and services are becoming more cost effective. So I think what you'll see is an emergence of services being able to be delivered to people who may not have been able to get service before, especially across a vast country like Australia. Well, for many, many years, Tunstall has been a manufacturer and a supplier of assistive technology solutions. For more than 50 years, we've been in the world in delivering these types of products. So now you see the services such as the simple alarm, being able to respond to someone who's had a fall or in an emergency situation. But now there's a vast range of equipment that can be added to the home that's more passive, even like infrared devices that detect if someone's been into the kitchen and had something to eat, devices that detect if someone's got out of bed and hasn't got back to bed in time, those sorts of things. So we've got smart technologies now that build a smart home to enable someone to be safer at home and in a lot of ways more independent. But now you see Tunstall delivering equipment and services such as tablets, touchscreen tablets, devices that are easy for people with chronic disease or elderly, people who not necessarily used to using computers. So we've developed systems and software that can be installed on an existing computer, or it can be rolled out on a small tablet that enables people to manage their vital signs, send through information to a clinician or a nurse practitioner, and be involved more in the understanding of their disease, and also be able to participate more in their medication compliance, in their diet, in their health, because they know more about their condition. Certainly we do. I mean, Tunstall's not in the area of delivering wearable, very sophisticated wearable tech, such as inserted devices, which is possibly going to be part of the future, and it certainly is now. Our expertise will be certainly in the area of delivering support to people who need to be mobile. The mobile network is much more reliable now, it's much more user-friendly, and our products and services can be utilised across the mobile network. Well, the Queensland Smart Home Initiative was established several years ago. It was at the very early stages of when people were starting to talk a lot more about technologies and assistive technologies being needed in the home and so on. So the consortium was formed by community organisations and universities and stakeholders who had a vested interest in developing awareness around assistive technology. So and continues to do so. So now there's a number of demonstrator facilities where people can users and decision makers and healthcare professionals can go into a virtual smart home and touch and play and see how effectively the technology works and give it a real life situation for them to experience so that they can apply it to themselves, because it's a very personal type of service. When you're starting to get into someone's home, when you're starting to link to other types of care and informal carers who are there to support that person, people have to feel it and touch it and see it to understand if it's going to work for them. A huge amount of effort goes into caring for people who want to stay independent from a wide range of individuals and people. So there's government support, there's paid support, there's community support, there's non-for-profits who provide support, but importantly there's the informal carer, there's the daughter of the mother that needs support, and there's the son and who's providing all the backup support for the family who may live nearby. So this technology is essential for those people, because we all lead very busy lives, and now you have both partners working in the workforce and probably working longer than they have before. So there's a need there to support those people, and a lot of the technology affects their everyday living, so they are able to keep in touch with the person they love and care for without necessarily always having to be the only person there to respond. Well, I think a number of factors. I think certainly the baby boomers coming through will have higher expectations, and they are very computer savvy, they're very health conscious, and I think we'll find their expectations will drive change, and consumers will be fairly demanding about what they expect. The medical industry itself will drive change. The government is obviously, responsible for a huge healthcare budget, so there's going to have to be interest by government, and there already is. You can see funding that's rolling out now, and Tunstall is a provider of those services for those programs. I think in about probably 3 to 4 more years, you'll start to see a lot more mainstream type of assistive technology solutions. The hope is that there'll be a Medicare item. The hope is that private insurers will start to be interested in this as well, to help keep people out of hospital and help provide wellness programs as a side to responding to incidents or events, more about supporting people to maintain their health and improve their quality of life. Well, I think it's a privilege to be asked to contribute to the health conference, and I think it's an opportunity to again create awareness and partner with a prestigious organisation that can add to the discussion table, and looking forward to that.